step-by-step guide of how to take a blood pressure measurement. 1. Initial preparation. Firstly, introduce yourself and verify patient identity using your clinical setting protocol. Obtain consent from the patient for the assessment and explain the procedure. Ensure that the patient has not had any caffeine or tobacco in the last 30 minutes. The patient should be allowed to rest for 5 minutes following the activity. Prepare the environment by making the room quiet, ensure patient privacy, and equipment is clean and intact. Blood pressure is measured indirectly with a stethoscope or Doppler and a sphygmomanometer. A sphygmomanometer includes the blood pressure cuff, connection tubes, air pump, and manometer. Blood pressure cuffs come in several sizes, and the size of the cuff bladder should be 80% of the circumference of the limb being assessed. Finally, perform hand hygiene before you start the procedure. 2. Choose a measurement site. The preferred site is the brachial pulse site, where the brachial artery runs across the antecubital fossa. Another site is the posterior thigh, where the popliteal artery runs behind the knee joint. A site should be free from pain, injury, surgical incisions, intravenous cannulas, central venous or arterial lines, areas with poor perfusion, AV fistulas, and AV shunts. This reduces the risk of patient harm and helps ensure result accuracy. 3. Position the patient either sitting, standing, supine, or prone, depending on your choice of measurement site. If sitting, their feet should be flat on the floor. The limb should be fully exposed so the cuff can be correctly applied. Do not apply the cuff over clothing. If using the arm, patients should be supported so that the midpoint of the upper arm is level with the heart, with the elbow extended and the palm facing upward. Then palpate the brachial artery to identify location and apply the cuff directly over the brachial artery. There is usually an arrow to indicate the center of the cuff, which should be directly above the brachial artery. Wrap the fully deflated cuff snugly, about 2.5 centimeters above the antecubital fossa, and secure. If using the leg, position the leg so that it is at an equal level to the heart. Then wrap the cuff around the thigh with the bottom of the cuff slightly above the knee. The popliteal artery will be used for blood pressure measurement. This is easier if the patient is in a prone position. Please note that the systolic blood pressure in the popliteal artery is usually 20 to 30 millimeters of mercury higher than in the brachial artery. 4. Palpate the artery to determine the systolic blood pressure. This ensures that the auscultatory gap does not interfere with the accurate reading of the blood pressure. Inflate the blood pressure cuff and note when the pulsation is no longer palpable. Release the cuff and wait 1 to 2 minutes. 5. Position the stethoscope over the brachial artery and use the bell side of the stethoscope. If a Doppler is being used instead, apply conducting gel to the site where the pulse distal to the blood pressure cuff was palpated. 6. Auscultate the blood pressure. Pump up to 30 millimeters of mercury above the palpated systolic blood pressure. Slowly release the pressure so that it falls by 2 to 3 millimeters of mercury per second. Note the manometer reading at Korotkoff phases 1, 4, and 5. Continue to listen for another 30 millimeters of mercury after it's gone silent, and then deflate the cuff rapidly. 7. If a repeat blood pressure measurement is necessary, wait 2 minutes before inflating the cuff again. 8. If required for your assessment, repeat the procedure on the other arm or in a standing position to gain a postural blood pressure measurement. 9. Remove the cuff. 10. Advise the patient of the result. 11. Clean and return the equipment. 12. Document. Results and documentation. Blood pressure is recorded as a fraction, with the top number representing the systole and the bottom number representing the diastole. If first and second diastolic are recorded, the first diastolic is written over the second. For example, 120, over 90 over 80. Documentation post the assessment is essential and should include the location the BP was taken and any factors that may have impacted the result. Further, it is important that health professionals note that any drastic changes in blood pressure can be a sign of clinical deterioration. Common errors: bladder cuff too narrow or wide, limb being assessed is unsupported, insufficient rest before the assessment, repeating the assessment too quickly, cuff not wrapped tightly and evenly, deflating the cuff too quickly, deflating the cuff too slowly, failure to use the same site for consistency of results, limb being assessed is measured while above their heart level.